excused tonight, Amy Manchester, Aiden O'Connor, and Dr. Jagoda. So Jagoda is out of the country in Greece. Disciplinary action. Department of Health advised that as a result of an investigation, David Manershoff, I didn't say that correctly, from Brooklyn, had his certification revoked effective 8/16/17 in violations of Part 800. .16, Section 8. Secondly, the Woodhaven Richmond Hill Volunteer Ambulance Corps, Ozone Park, New York, Agency Code 7374, had their certification revoked effective 8/16/17 for violations of Public Health Law, Article 30, Section 3012, 1F, and Part 800.21F and 800.21C. Under correspondence, course applications, Mohawk Ambulance EMT Refresher Course started 9/15. Hudson Valley Paramedic Refresher starts October 22nd. Rensselaer County Ambulance and Rescue Association EMT Refresher at Regeneron Pharmaceuticals starts October 28th. And Mohawk Ambulance EMT Original starts 12/15. Additional correspondence, audit engagement letter from Teal Becker and Chiaramonte for fiscal year ending 9/30/17. Any questions? CON committee, Jim?
Yeah, it's actually been a fairly busy few weeks for the CON committee. We received 3 different applications for the transfer of operating authority for various entities. The committee met, the applications were reviewed, in some instances corrections or additions were made, and once complete, the applications were forwarded to the Department of Health for their reply to us regarding the fitness and competency of the applicant that's requesting the transfer of that operating authority. So the replies were received from the Department of Health for all 3 of the items that are on the agenda. And we're going to vote individually on those. Just one clarification for the agenda that you guys have in front of you or that would have been sent out, and that is in regard to Capital District and Physicians Ambulance. While everyone is aware that there's an entity called Mohawk Ambulance, the actual transfer is to a company called Parkland Ambulance that does business as Mohawk Ambulance, and that's how the applications were received, and that's how the Department of Health reviewed those documents. So, again, just a point for the record that that's actually what's been proposed and what we will be voting on. In each of these instances, the CON committee met and forwarded a motion for a vote to approve the finding of fitness and competency by the Department of Health and forward it to this committee for a vote. If we want to go one by one, that's probably most appropriate. I will make reference to one thing, and that is that the motion is essentially identical for both Capital District and doctors or physicians, and it's to transfer the operating authority for the territories as described in the application, and that is the City of Schenectady, the City of Albany, and the City of Troy. So that would be Capital District,
Okay.
2 Parkland Ambulance.
All right, so Anne Marie asked me as vice chair to do the vote. So the first vote, and this is a seconded motion, that's coming before the council, is the transfer of operating authority from Capital District Ambulance to Parkland Ambulance. Is there any questions or discussion for the council? Okay, being no discussion, we can do the vote. So a vote of yes is accepting the recommendation of the CON Committee on Fitness and Competence for Mohawk Ambulance / Parkland Ambulance to assume authority, the operating certificate of Capital District Ambulance. Les Fremantle.
Yes.
Brian Wood.
Yes.
PJ Keeler.
Yes.
Scott Bowman.
Yes.
Ken Martin.
Yes.
David Bettini.
Yes.
Aidan O'Connor is excused. Stephen Bucato.
Yes.
Kathleen Allen.
Yes.
Amy Manchester is excused. Skip DeBernitz.
Yes.
Kevin Robert.
Yes.
Is Ashley Edwards here? Okay. Ashley Edwards.
Yes.
Okay, we gotta get you on the sign-in sheet before we vote. Okay, Tracy Weir. Tracy Weir is not present. All right, Dale Lingenfelter. Not present. James Vina.
Yes.
Dave Massaro.
Yes.
Dr. Daly.
Yes.
Dr. Jagoda is excused. Maria Walker.
Yes.
Carol Brandt.
Yes.
Lynn Kane is excused. James Stairs.
Yes.
Zareta is not here. I don't think she's not here. Okay. Steve Retzloff.
Yes.
Jeff Williams.
Yes.
Anne Marie Cross.
Yes.
Is there anybody who I failed to call that is a voting member? Okay, then the vote on this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 yes, and no no's and no abstentions. Okay.
Okay, well, not wanting to be redundant, essentially the same motion for the transfer of operating authority from the physician's ambulance to Parkland Ambulance Service. The motion is to transfer as applied, and the territory is described as the city of Albany, the city of Troy, and the city of Schenectady. And that comes as a second motion.
Is there any discussion on the motion? Okay, roll call vote. Les Fremantle.
Yes.
Ryan Wood.
Yes.
PJ Keeler.
Yes.
Scott Bowman.
Yes.
Ken Martin.
Yes.
Dave Bettini.
Yes.
Aidan O'Connor is excused. Stephen Mercado.
Yes.
Kathleen Allen.
Yes.
Amy Manchester is excused. Skip DeBernitz.
Yes.
Kevin Robert.
Yes.
Ashley Edwards.
Yes.
Tracy Weir is not present. Dale Lingenfelter is not present. Jim Vina.
Yes.
Dave Massaro.
Yes.
Dr. Daly.
Yes.
Dr. Jagoda is excused. Maria Walker.
Yes.
Carol Brandt.
Yes.
Lynn Kane is excused. Jim Stairs.
Yes.
Zori is not present. Steve Retzloff.
Yes.
Jeff Williams.
Yes.
Anne Marie Cross.
Yes.
Are there any eligible members that I did not call on to vote? Okay, so the vote on this motion is 20 yes, 0 no's, and 0 abstentions, so this motion has been agreed to.
The third item, which is for consideration, is for the transfer of operating authority from the General Schuyler Emergency Squad to the Wilton Emergency Squad. That comes as a forwarded motion to accept the findings of the Department of Health, no part of the fitness and competency for the transfer, or for the transfer to occur. And just as a additional clarification, it's as the existing operating license describes the operating territory. So that's a seconded motion.
All right, so we have a seconded motion. Are there any questions for this chair on this or any discussion? Okay, so we're gonna have a roll call vote, and this is the transfer of operating authority with Wilton General Schuyler. Les Fremantle.
Yes.
Ryan Wood.
Yes.
PJ Keeler.
Yes.
Scott Bowman.
Yes.
Ken Martin.
Yes.
Dave Bettini.
Yes.
Aidan O'Connor is excused. Stephen Mercado.
Yes.
Kathleen Allen. Amy Manchester is excused. Skip Burnitz.
Yes.
Kevin Robert.
Yes.
Ashley Edwards.
Yes.
Tracy Weir is not present. Dale Lingenfelter is not present. Jim Vina.
Yes.
Dave Massaro.
Yes.
Dr. Daly.
Yes.
Al Jagoda is excused. Maria Walker.
Yes.
Carol Brandt.
Yes.
Jim Stairs.
Yes.
Zori is not present. Steve Retzloff.
Yes.
Jeff Williams.
Yes.
Anne Marie Cross.
Yes.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. There were 20 yeses, no nos, and no abstentions. The motion is agreed to. So, thank you to the CON committee for a lot of work that went into getting us to this point to be able to bring it before the Remsco.
All right, report of committees. Tim, executive director report,
Excuse me?
committee report?
Okay. I'm gonna have a lot to talk about tonight. Should I ask the group to bump me to last and get the routine committee reports and everything else out of the way first? Would that be okay? Because I need to talk about the budget and the business plan, and I'm wondering if that would be the best order of business if I did that last tonight.
Okay, sounds good. All right. PJ, is there anything else about the treasury report?
Right here. What'd you say?
Did you want to, report on the treasurer's report? You
No,
had
for
said
the sake
they
of
could just
time,
read
I
that.
think it's all written down. If we can skip that, if anybody has any questions, you know where I'm at.
Okay. Finance committee, Steve?
Thank you. Everybody that is a leader of an agency should have received a Survey Monkey from the Remo on Sunday evening, or so was it Saturday or Sunday? Over this weekend, that is part of our incentive compensation program. Our incentive compensation program for the staff is partially based on fiscal performance and partially based on customer service metrics. To measure the customer service metrics, we use a member survey. We sent the member survey out in 2016, and now we're sending out the same survey a year later to see what people think about how we've achieved some of the metrics that the staff, with the guidance of the council, has been moving towards. I'd like to ask all of you who are agency leaders to make sure that your agency fills out this survey. And I'd like to ask all the chairs from the counties, the reps from the counties, to go back to their county and encourage agencies to fill the survey out. We have not had great responses the last time we did this. And I think somebody said in our meeting earlier that, well, if I don't have a problem, I don't worry about surveys. We want to establish sort of, be able to, where you trying to use a metric to say to the staff, you've accomplished your goals through what people think of the work they're doing. So we really do need people to fill out the survey, even if they don't have a problem, or if they don't feel, they don't have a wild, think that things are wildly great, just, we want people to fill it out so we can use that data. So I'd ask the county chairs to go back to their counties and encourage every agency to fill that out. That'll be used to, it's for our fiscal year 2016. We're a year behind in paying out those incentive compensation funds to the staff, so we want to wrap that up very soon. And then at the next meeting, we need to talk about our 2017 incentive comp, because this meeting is the last meeting of our 2017 year, and whether we're going to use this formula or the same formula. So please get people to fill out the survey. Everything else in the Finance Committee really will follow after Tim makes his presentation on the business plan, because a lot of it has to do with the budget going forward and some of the things that he wants to talk about. So, anybody have any questions?
Medical director report, Dr. Daly?
So if we can combine everything here quickly, probably a couple of most important things. The first is, we had a presentation from the folks from St. Peter's Health Partners. It was really quite exciting, talking about their plans for St. Mary's and hospital coverage in Troy, the timeline and plans for Samaritan, which sounds like it's going to be a really exciting emergency department as they rebuild that physical plant. St. Mary's becoming an urgent care sometime in December, which is going to be an interesting change for everybody, but I think will ultimately work out well. And then their plans for hospitals in Albany. Obviously, everybody was on the edge of their seats waiting to find out what the answer there was going to be, since wait times at both St. Peter's and Albany Med tended to be, shall we say, suboptimal. And Memorial indeed is going to remain a full-service emergency department for now. That was a drastic change in strategy from what I think my St. Peter's Health Partners was going to do. The other thing that they are probably going to do is transfer some of their admitted patients to floor beds at Memorial, and that's going to be a drastic change operationally within that institution. But they encouraged us to make sure patients were going to Memorial, patients that were not critically ill, patients who required basically bread and butter emergency medicines would be treated well there. And that frankly was exciting. Other things of note, the REMAC worked to do some clearing up of its bylaws, cleaning up some little issues. It's doesn't really matter here, but it's just fascinating to find out how to spend a lot of time working on bylaws. You can still have things where you miscount total numbers of people or come up with some ideas that could be better done differently. We voted on a EMS ALS upgrade, which I think will ultimately serve as a model for other agencies and systems, where we voted on an upgrade for Delmar Bethlehem to the paramedic level, but only in concert with their relationship with the Albany County Sheriff's Department. So when an Albany County Sheriff's paramedic is operating on a Delmar Bethlehem ambulance, that then becomes an advanced life support paramedic level ambulance. They only need to complete one ambulance call sheet, so there's only one PCR reflecting the call that was all the care that was provided. So there won't be redundancy in documentation and potentially documentation that contradicts each other. It'll also make for a much easier pathway to bill. Frankly, I think this is a fantastic idea. I'm glad that Delmar Bethlehem and the Sheriff's Department worked this out. To Steve and Brian, thank you very much for setting up this model, and let's see if it carries farther, because I think it'll make a big difference. So that was great. Had a bunch of other discussions, including discussions about something that Rich is working on, working with Collegiate EMS, which is exciting, making more inroads to getting Collegiate EMS to work together. And we started talking about traction splinting as well. In particular, and I had a patient that presented today actually wearing a traction splint. With a reminder one more time, the hair traction splint was fantastic technology a long time ago. And now we have better technology and actually less expensive technology. So I would say look to some alternative agents from the hair. We're passing this one back to the RTAC and the ortho folks for their suggestions. And hopefully we'll get a position where we can make some clear-cut recommendations. But remember, if you put a hair tracking splint on, make sure it's done right. Even if it is done right, it can still slip up behind the ischial tuberosity, which is actually hair traction splint is where we all learned that word in the first place, right? And if it does, it's providing absolutely no traction and probably some harm. So those would be big things from the REMAC, the academics. Well, thank you.
Thank you. Steve, EMS Council?
The EMS Council meets on Wednesday, so we'll have a report at the October meeting.
Nurse Committee, I will report on, we met on September 5th. We talked about crisis patients in the ED, patients who present for suicidal and homicidal, and we all discussed how the numbers have increased exponentially over the last year, and both adult and pediatric adolescent on-site patients, and how when they are brought in, either from EMS or they come in ambulatory, they require a one-to-one sit in the ED. So we had a lot of discussion about that and, resources available and trying to keep, patients safe. So I know many of us have reached out to our administrative team trying to, get additional resources for, I know I had put in for some additional tax for in Saratoga, so our numbers have just increased. We had pulled our tax just for the first 6 months of the year. We had to pull them off the floor. We had over 5,000 hours, like 5,900 hours of just tax pulling out to sit with a one-to-one patient. So we were all kind of in the same situations. We had a big discussion about that. Maybe just looking at some best practices of how we can manage the patients and keep them safe. We talked about slide sheets, which is something we wanted to bring here. Discussed a one-for-one exchange with either those slide sheets that we use or the hover mats, and had a lot of discussion about that. So really protecting the backs of EMS providers as well as ED staff, and maybe having that either hover mat or slide sheets on every stretcher in the ED, and having you guys using them and then bringing them, transferring the patient over. So we're getting some prices, getting prices of hover mats to try to see if we can get like a bulk kind of price. But we thought that we would, we'll bring it next month with more of the pricing. But if we could, get input or at least give everyone a chance to maybe think about that. And if we started with that initial, say, distribution of those slide sheets, so that then when you guys come in, we'd be able to do that. I know that Albany Memorial was doing, some kind of an exchange with one of the EMS down in Albany to try to see if that would work, and I just kind of trialed it with some of the sheets, slide sheets that they had, and they, said that worked pretty well. So if you think about that, we can, we can bring it at the next meeting, and I'll have more pricing. Amanda Behringer from Albany Memorial is getting prices for us, and with cover mats and then slide sheets, so hopefully have more on that. We talked about the one-for-one exchange of the meds. The Medrol changed to Decadron, and narcotic exchange is different per hospital policy, but there really haven't been any issues that we had discussed there. And then the last thing, we had really a big discussion about the violent patients in the ED and some of the things that we're encountering just as you are, I'm sure, with the patients who are more combative, and there have been some injuries, some significant injuries in some of the hospitals in Albany. Nurse at St. Peter's was injured significantly with a fractured arm, and somebody at Albany Med had a fracture, and we've had some haven't had that where it's been resulted in that injury, but we had quite a few injury at Saratoga as well. Nurses have been punched in the face, and we had a physician who was punched in the face and had a laceration in his lip, and so we've had a higher increase as well. So again, trying to get more security presence in that in the ED, but we talked about that quite a bit. And our next meeting is going to be on November 7th. We meet every other month, and Ellis is going to host it. So I have my report. Any questions? PJ, MCI committee?
No report at this time.
Okay. So Lynn is excused from membership, nominating committee, awards and bylaws. Dean, MCI committee?
We meet next month.
Okay. All right. County reports, and Albany, Brian? Report. Columbia, PJ?
Columbia currently has an EMT refresher course that's started up in September. We'll test out, I believe, in February.
Green County and Rensselaer are excused. Saratoga, Kevin?
No report.
And Schenectady County, Jim Vina?
No report.
All right, so Tim, it's you for new business.
Okay,
Proposed budget.
the first thing I'll get out of the way, before I get into these couple bullet points, first two bullet points on new business, is my executive director's report. Everybody should have a copy. But the one biggie on that is that top line, our annual banquet. As of today, we have 60 registrants, and we have a house that will fit about 100 to 110 max. Last couple of years, I had to try to drum up business. This year, the floodgates open, and it's filling very fast. So if anybody is planning on attending that, please give JC a call at the front desk, extension 3006, and we will get you on the list. Seems to be a hot commodity this year. Longfellow's Restaurant, exit 14, Saratoga, great place, so. All right, I'm gonna cover the first two bullet items in, under new business. Just for a refresher and for some of the new folks here that may not be familiar, if you're not, I'll talk about our fiscal year. Our fiscal year runs from October 1st until September 30th. Our fiscal year is just about to end. Every year at this time, I come and I give you guys a proposed budget to consider and hopefully approve so we can conduct business for the following year. First number of years I was here, I always strove to be pretty much budget neutral. Try to save money, build it up, build it up, build it up. Last year, we spent some money. We appointed a full-timer at the front desk. This year, I come to you, everybody should have a copy of the budget. I apologize for the font. When I formatted to the page, that's what it cranked out. I will send everybody an electronic copy of the budget, and I will send everybody an electronic copy of the business plan I'm going to speak to tonight as well. But I came to the conclusion this year, we're in a pretty good place. We are financially solvent. And I thought it may be time to expend a little bit more money. Not to spend money for spending money's sake, but for the betterment of this organization and the services that we provide to our constituents, namely the region, the agencies and the agency providers. So hopefully this budget will be a projection of that. Advance the slides, Dean. What I wanted to do, everybody has a copy of that, everybody has a copy of the business plan. Business plan is pretty heavy material-wise. That's why I'll send an electronic copy. None of this is going to be acted upon tonight. I'd like you all to take everything I talk about home and the handouts home. Think about it, digest it, discuss it, and come back in October and hopefully we can enact this stuff. Too much there to go through in one night and expect folks to vote on it. Budget. Budget is broken down in two sections, personnel expenses and operational expenses. And what I'm going to talk about tonight are the highlights, or what I think are the important points or changes that I've made relative to this, relative to personnel. I need to appoint a new front desk person. The reason I need to appoint a new front desk person is J.C. Guzman came to me 1 week before SUNY class started this summer, told me he was going back to school. He gave me a week's notice and he went back to school. That is a 5-day-a-week job. We need a presence of a person answering the phone and sitting there 5 days a week. It's the nerve center of our organization. So first thing I'm going to propose is I hire a new front desk person. I'd like to hire somebody with what I would call secretarial experience. Somebody that can answer our phones, somebody that can take messages and send them to the various offices here so that business gets done. Whatever else transpires relative to that job, they can absorb it. They'll learn how to print cards. They'll learn how to read rosters. They'll learn all the other little administrative tasks associated with that. But what, first and foremost, what I need to do, and it's broken down in the budget, is hire a new 5-day-a-week full-timer. I propose to do that and offer them a benefit package. We call it, we researched an individual plus one. Namely, they can get it and name another designee there. If they opt for that, that's great. If they want something else, we'll negotiate with them and we'll alter that benefit package. But I plan on offering that as a full-time position with benefits. So that's number one. JC is our brand new CIC. JC went through our grooming process here to become a new CIC. He did it satisfactorily. He also passed the state exam on his first attempt. He's a brand new CIC. JC's not going to go somewhere in the interim unless he decides to up and move, relocate or something. But he brings value to this organization. We invested in him becoming a CIC. I have a training office that's manned right now by Rich Ruther that's sitting in the back. He works 12 hours a week. As you can see, we have a very robust training schedule here, and I need to supplement the days or the hours that Rich is not there with another body. We spent a lot of time bringing JC up to speed, becoming a CIC, and I would propose to put JC in the office to fill that seat when Rich is not available. Rich is only here a couple days a week. JC would be here a couple days a week. I think I broke it down in the budget. I'm proposing 14 hours for that. No, I'm going to create a new position here too. I'm going to make some changes in QA/QI, or what I refer to as medical standards. That office right now is currently manned by Dean and Deb Cuffs. Dean does 3 days a week. Deb does 2 days a week. I'm going to pull Dean out, and I'll speak to that in a minute, but I need to put somebody else there because second to the front desk position, medical standards, QA/QI, their phone rings more than any phone in this office. It's a heavily customer service-based office. We need to have somebody there presence-wise 4 to 5 days a week too. I'm going to propose bringing another part-timer there to satisfy that QA/QI need or that QA/QI requirement. I'm also going to create another position, and I'll call it, and I have to credit Steve because he coined some of these terms, he helped me. We're going to have a REMAC or a CMAC liaison, somebody that our REMAC chair can call to and have a designated point of contact to go to, somebody that the regional medical director, REMAC chair, CMAC chair, whoever it is, they can call Remo and they're going to have a go-to person. I think it's important to maintain that line of communication. If we have somebody designated for that, these guys don't have to think about what extension they're going to call to talk to somebody and get the answer that they need for something. So that person will do a dual duty there. Not only will they pick up QA/QI, and I'm going to be looking for somebody well-versed or experienced in QA/QI, they're going to be the point of contact for our guys too, our chairs and our committee people. Dean's not going anywhere. I'm pulling Dean out, but the reason I'm pulling Dean out is because if you remember over the last 3 or 4 years, we've invested a significant amount of money sending Dean all over the East Coast and the Midwest for various EPCR conferences, image trend conferences, stuff like that. He has become not only the in-house, but one of the regional go-to guys for electronic platforms, especially on the back end of that stuff, which I have no idea what happens there. Scott can speak to that, but we're going to expand our IT offerings as well. So Dean's going to inherit some new responsibilities here. Not only will he be that EPCR go-to guy, he'll handle image trend and the state bridge. And you're going to see a lot more data management and data integration coming up, in the following years. We need somebody in the office to handle that stuff. Some of the other things I'm thinking of is our Remo Online, where the medics in the room log on to get their signals and stuff. We contract out for those services. I think the time has come to start giving some consideration to us handling that stuff in-house. I sign a pretty hefty check once a month for people to man that system, and I'm starting to think really long and hard, why can't Remo do the same thing? Perhaps even a little bit better if we have in-house service and somebody that can respond almost immediately to that. So Dean's going to inherit some of those IT responsibilities, and whatever else we think we're going to develop and move towards down the pipe, he's going to be the go-to guy for IT. Actually, we can skip some of these because, as I told you, my reassignments and changes relative to personnel, I also gave you a background on what these folks would be doing or what my expectations would be for them. One thing I'd like to talk to, back up a slide, Dean, is some of these assignments are going to result in reduced hours for these folks. JC is going from a full-timer to about 12 to 14 hours a week. Dean voluntarily is stepping down a day a week. Those hourly savings will be used to offset the hiring of the new personnel I propose to bring into the office. Second half of the budget is operational expenses. Most of the stuff you have there is black and white. I bumped some of the line items up a little bit. I dropped some of the line items down. But I've created 3 new line items there I think you need to pay attention to. Going hand in hand with moving forward here and growing the organization, I think we should offer a little bit more relative to services or what we can give back to our constituents. One of them I would propose is creating some type of educational conference. An off-site, comprehensive, one-day seminar, keynote speakers, you know, breakfast, lunch, Desmond, Marriott, wherever we choose to hold it. Everybody does it, and I see Remo doing the same thing. And I think it goes along with our mission, our vision to give back to the community. That's one thing I'd like to see here is an educational conference like that. Core content CME basically goes along the same lines. We're going to start offering in-house CME. No charge, people can come in, get a few slices of pizza and some soda and stuff, and sit through a night's CME. We're going to schedule probably 6 sessions a year starting off, bring in some speakers to speak to those needs, and hopefully we'll see where that goes. And if it's popular, maybe we can expand that as well. Outreach and PR, and this is something I think we're lacking here. Something I would like to get into more, something we need to look, research, and develop more. How can we get the Remo footprint out there, expand that Remo footprint? There are markets out there. There are people that I don't think we're hitting, or I don't think we're hitting sufficiently. Civic organizations, senior groups, Boy Scouts, Girl Scouts, high schools, whatever it is, try to get out there and get the mission and the vision of Remo out to these folks and let them know who we are and what we do. We currently man a couple different tables a year now. We hold a table at the SUNY Job Fair, which is relatively well attended, and we get a lot of questions answered there. And some of that stuff has evolved into our SUNY EMT classes. We hold an outreach table every year now down at the Columbia Green EMS Education Day. We go down there, we set up a table, we put a placard, we throw some gifts down there. It's proven a tremendous way to reach people that we would normally see up in this office. Especially with Columbia Green, we get the Greene County and some of our southern constituents. They'll come up and talk to us about their wants and needs down there. May not necessarily make the drive up here. So all in all, I think that was a great thing to do, and we're going to continue doing that. I'd just like to expand that offering through the region. Anything else up there? A couple changes on the budget. Not really changes, but I had to bump some stuff up. The first one is the audit. The first one is insurance. Our D&O, Directors and Officers Policy, will come due this year. I think it's every 2 years it comes due, or every 3 years. That's going to give us a little bit of a bump of insurance expenses, so I had to bump that line up to correspond with that. The audit is going to jump up a couple $100. Last year was $16,800. I got the engagement letter, I sent it in. They're going to charge us $17,000 this year. Along with that, that's the professional services line, I believe, or what professional fees. The other part of that is our legal consultations. We've reached out to Terry Hannigan a number of times this year for consults and opinions on various matters. Depending on how Terry feels, sometimes we get a bill, sometimes we don't get a bill. Lately, we've been getting bills. And with the bylaws talk and stuff coming up now, I foresee me sending emails to Terry, so I bumped that line a little bit up, just in case he decides to send us a bill for his services. Anything else on there?
Good.
Is that it? So, you guys should have a copy of the business plan. I was tasked this summer with developing a business plan, and that's not a bad thing. It was homework for me, and it took a while to create this, but it's not bad to have a blueprint or document that we can refer to moving forward. And that's exactly what it is. A lot of heavy content in there, you know. I expect, that's why I'd like you guys to review it over the next several weeks and stuff and come back informed relative to that. But basically, that's my vision, strategic management-wise. Where we are right now, where do we need to go short-term, and where would we like to go a little longer down the road after that. So I've incorporated short-term objectives in there. I've incorporated long-term objectives in there. I've asked questions, you know, in some of the objectives, you know, like community paramedicine, what would Remo's role be and stuff like that. But I set out a bunch of different objectives that I thought these are the kind of things I need to address, be they short-term or be they down the road, to grow this organization. Everything in there, I believe, conforms to our mission statement, conforms to our vision, conforms to some of the stuff that we talked about in our retreat last year. I mean, PJ was right when he brought up in the executive board tonight that we really haven't acted upon a lot of the stuff we talked about. People had fantastic ideas and suggestions relative to how we could improve functioning of the organization. So I think you'll see in this business plan some of those ideas. I tried to put some of the notes I read from the retreat, and I tried to put them into this business plan in a way that it would make sense for the organization. The last thing, and this is probably the most important, I could just say remain relevant. You could throw out that business plan, you could throw out the budget, you could throw out everything else. Because if we don't remain relevant in the eyes of the region, in the eyes of the agency, in the eyes of the providers, I want you guys to tell me where we stand. Because if we don't maintain that relevancy, we lose our importance here. So everything I did on there, everything I put down in black and white pertains to this organization remaining relevant as we move forward. Those I thought were the important bullet points. There's a lot more stuff in there. Go home, digest it, like I said, over the next few weeks. Give me a call, drop me an email, let me know what you think. We can change some of that stuff as well. But I wanted to give you guys something to take home and think about. Then we can come back in October and we can talk about it and hopefully enact something. I'm done.
I want to make a comment from the Finance Committee. As Tim was working on this, he did talk with me about the financing of this. And there's something in the business plan and the budget that merits definitely bringing up here. There is a chart in the business plan about Remo's net income each year over the last 6 or 7 years. We have come out very positive over the last, in other words, more revenue than expense. And generally, the revenue has been significantly above what we've budgeted. So, for example, the budget for the last year had a $75,000 net income built into it, and we came out at about $160,000. So that's $85,000 more than budgeted. Tim is budgeting spending more in the 17-18 budget than the 16-17 budget by about $50,000, $45,000. That is not coming out of anybody's pocket. So that's not going to decrease the reserves of the organization or come out of our bank accounts. It's not going to be some money we have to collect from somebody. It's taking some of the profit that we've had each year and reinvesting it in improving services so that there'll still be a net income. It just won't exceed the budget by as much. So it's that's important to point out. And also, as you read the business plan, there will probably be a spillover effect that some of these investments will generate new revenue. More people taking CPR, more people taking courses. So it may, in a second way, not only doesn't it come, it's coming out of already the revenue excess over expense we have, but it may generate new revenue that's excess over an expense. So I think that's just important as we look at the budget to do that. We do need to take one action tonight, and I'll be willing to make the motion when it's a proper time. Our fiscal year ends on September 30, and we run into this each year. We come in after being out for the summer because we don't meet in August, and sort of the budget has to be done right away. It's not fair to ask anyone to vote on a very big change in budget when we get back. So when it's appropriate time, I'd like to move that we extend the current budget for 1 month, which means that Tim can incrementally spend the same that he spends now, from now through the end of October. That gives the Remsco the time to consider all of this, come back, and then adopt the budget in October. I'll second that motion.
In favor?
Aye.
Opposed? Under old business, Scott, did you want to discuss anything?
Could we back up 1 second? There were a couple other bullet points, and I think I would need to speak to those under new business. Per our auditor's request from last year, they had no really significant findings, but they came up with one recommendation, and that recommendation was the adoption of a Remsco policy for capitalization of property and equipment purchases, namely a fixed assets policy. And I wrote down exactly what they said, and I don't know who has a copy of it. I don't have my paperwork here. But what I ask is the council needs to adopt a fixed assets policy to conduct business here and to keep our auditors happy, and that won't be a finding next year. Policy for capitalization of property and equipment purchases. All assets valued at $1,000 or more will be all assets valued at $1,000 or more will be capitalized and depreciated over the asset's useful life. If everybody agrees to that terminology, I would ask the council to vote that in, and that become a formal fixed assets policy.
That
Make our
dollar
auditors-
amount was the.
That was the auditor's suggestion. I went back and checked with Dave, and I said, Dave, do you think that's enough? Dave said he thought it's enough. Dean comes to me and goes, I don't think that's enough. So if anybody here has some auditing experience or something, I'd be happy to hear relative to this term. Do we need to bump it up a couple $1,000s or not? But I would defer to the council on that.
I guess it's a question of the number of assets that you have that are $1,000. If you have a lot of them that are, say, $1,000 to $2,500, it's just a lot of work and maybe not worth it, especially if they have a short lifespan.
The only big things we have are our copiers and our computers. We cycle through our computers, so I don't know whether it's beneficial to bump that number up or not.
Somebody else probably has more experience than I do in this. I mean, I would have thought it a little bit higher too, just on first glance.
I'd
but
just like to make a recommendation that you bump it up to $2,500.
That's kind of what I was thinking.
Something like this, usually the amount of capital assets that you have here, so $1,000, you're gonna write it off over a period of a year. But I mean, you're
Right.
talking about rugs, furniture, those types of things.
And in this day and age, when I mean, a laptop is almost disposable at this point in time, I mean, it's just kind of silly, it seems to me.
Everybody be okay if I just change that amount to $2,500?
I would make a motion that we adopt this policy as written, changing 1,000 to 2,500.
Second.
Okay, last item of business I have. Oh, I'm sorry. Go ahead.
So just when I got it right down. All in favor? Opposed?
I had to screw it up.
Blue. Okay, motion stands for 2,500.
All right, sorry, thank you. Last item of business I have. Hopefully everybody knows the way we conduct business relative to check writing and issuing. We need 2 signatories on every check. The executive director is 1 signatory, and one of the council members or officer is another signatory. We changed banks to Key Bank a ways back. We used to have a couple signatories. The only signatory I have from all you folks right now is Steve Kroll. So I brought it up to the executive board. I'll bring it up to the council. I'd like permission. I already have the paperwork to gather a couple more volunteer signatories out there. It might make it a little bit easier for us to conduct business, because I'm always here and I can sign a check. But if Steve's on vacation or out of town on business or something, you may not see checks issued for a couple of weeks sometimes. And that's not always good business. So I'd like to add a couple signatories to our check cashing policy, and we've had great fortune of having 2 volunteers step up. Steve Retzlaff has volunteered, and Kevin Robert has volunteered. And they're both relatively local, and they're both relatively easy to track down, and I think that would solve my problem if I had a couple of those guys on board with Steve.
Dave, can I just make an outside-the-box recommendation here? It is 2017, and rather than you running around the middle of the night trying to track down a second person to sign a check that they don't know
I
what
do
they're
that.
signing, I believe Dave uses QuickBooks,
Yeah.
okay? Dave can spit out a disbursement sheet to be approved by myself as treasurer and one of the other executive committee members that would just approve it, and then he would send a check register to say check 101 through 1010 was dispensed, and you'd only have to have 1 signature. And if you double check with the auditors, I believe they would approve that. It
All right.
would save you a lot of chasing around.
Would
So
that
this conversation has come up at the bylaw committee. Carol and I were just whispering over here whether or not I should pose the question and just float it out there and see what people thought. This conversation has come up at the bylaw committee, whether or not in this day and age, anybody should have to be, let alone just Tim, but whether anybody should be running around trying to catch up with somebody to get a second signature on a check, especially for routine stuff. So we had kind of floated an idea of a dollar amount, and whether or not that was something that the council would consider, because I think currently it's in the bylaws. So even if your idea was
I would set,
to be
I
considered.
would set a cutoff maybe for a dollar amount, you know, anything over 5,000 has to have a dual sign off or something like that, but other than that, guys, it's 2017.
Yeah.
You can just email, I can approve it, or one of the officers can approve it. Dave can cut the checks, and then he sends back a check register and just says, yep, check 101 through 110, and here's how they dispersed it.
Yeah, I think the way the conversation was left ultimately was that we were curious what the auditor, what the
You have to
auditor's
check.
opinion was on it.
But the auditor will require that whoever is replacing the dual signatory, so that if it's, and I would recommend we not necessarily sign it as a person, but we sign it to a title.
A title.
Because people change, so it would be the treasurer and two other, treasurer, vice chair, secretary, or past chair, or whatever is designated, that the documentation has to be in the bookkeeper's file that shows them electronically signing off, because the auditor will go back to PJ and say, I have an affirmation from you that you signed off on the check run on, October 12th of 2016, and PJ could have to look at that and say, yes, I signed off on that. So this doesn't absolve us from responsibility.
Right.
The staff bookkeepers should not be dispensing bills that have not been approved by both the executive director and a member of the volunteer leadership. It's just a mechanism of approval. Will be a memo that says, it may just be an email from PJ to say, I have read the journal, marked XYZ on this date and approved checks numbers X plus through, X plus 12. That's still gotta be in there. But it means that, literally, Tim and I catch up at 11:30 at night on a street corner in Slingerland sometimes to do checks.
So, who is it that communicates mostly with the auditor? Is it you, Tim, or is it the finance committee chair, or is it the treasurer? Who generally,
It's either
who's the
me,
best person to drop a line to the auditor and ask this question?
either Dave or myself.
Maybe we can get an opinion on that, at least for the bylaw committee, because the authorization to sign checks is in the bylaws. So if it's gonna stay in the bylaws, we need some feedback on it and whether or not, what the auditor's opinion is on this. And secondarily, I guess probably for the larger group, is this even gonna stay in the bylaws? I think you could probably make an argument that it's a matter of policy, how we do things and conduct business from day to day, and it probably doesn't need to be in the bylaws at all, so. Kind of two questions.
And I think there's a third question, which is you're asking, which is our bookkeeper willing to switch the system he uses? not proposing that he's using an electronic system that will be more digital than what he's using today, and it automatically generates a report. It's going very different than the reports we get today, and it's automatically going to the treasurer, being responded and archiving. That means modernization of how we do our bookkeeping. And so that's just, I know you're smiling on that, but
We
we've
have
talked,
the capability.
we've talked about that for years, and we've basically not pushed it. This is gonna push it. He's gonna have to say, okay, I'm doing, Tim's gonna have to instruct him to do that.
I have faith in Tim.
Yes.
I'm sorry, I'm going, in June, Jim Stairs asked me to get an example of a QuickBooks finance report, as opposed to the finance reports everybody has in front of them. We did get that. I'm going to give it to Jim just so you can look, and I think that speaks to what Steve was talking about too.
If you want to just send it electronically, I'm fine.
I'll give it to you and I'll send it out to everybody electronically.
Jim could find it. Come on, I only got one tonight, that's it.
You know, in the meantime, if he has to get somebody else's a second signature to get this up and running, that's what he has to do.
I mean, I would go with whatever the auditor suggests, but I think it makes a ton of sense to use, as I think Steve mentioned, to use titles as opposed to people. And as PJ described, it probably, makes a ton of sense to just send out the projected disbursements or disbursements per whatever the report is and allow that to be approved and go from there.
I'll send an email to the auditors tomorrow morning.
Under old business, Scott, did you want to discuss the insurance coverage?
I know,
I guess I'll just mention it, and what the question was originally, for those that might not remember, back to spring or early summer, but we, in light of the REMAC bylaw changes and all the discussions that floated around that, the question arose about insurance for the medical director position and whether or not such insurance existed, and I questioned that, and Tim asked our insurance carrier. Last conversation I had with Tim, it was basically nobody knew anything or had an answer for us, so as it turns out, I think maybe I asked a pretty good question, I don't know. So maybe Tim, you can tell us more now at this point.
well, Scott brought up the question, does our regional medical director need any additional or need any type of insurance coverage or protection when he conducts business for us, whether it be in here, whether it be in the field? So I posed that question to our insurance carrier, and they immediately said, you need malpractice insurance. And I don't know if that was the umbrella that we needed or not, so I bounced the question back to Terry Hannigan. He wasn't quite convinced we needed that, but he really didn't have the answer either. So we sent it back to the insurance carrier, and we haven't got another reply from them yet. I'm not sure this is a question that they've been asked before. You know, they hear MD or they hear doctor, medical director, and they think the guy needs malpractice insurance. Is it malpractice insurance? Is it a form or another form of liability coverage or insurance? I don't know. And I'm not sure they know either, but they're working on it. I just don't have the definitive answer yet. So,
Would you be able to just, when next time you meet with your colleagues from the other program agencies, or just send them all an email saying, what do you do for your medical director and the insurance agency, if any of them, if they all have something that's different than if they all don't have something or don't think it's an issue?
sure.
Yeah, maybe the answer is that it's ultimately not an issue. I mean, I just don't know, but I suspect that the hospital's carrier may be less than thrilled and not so inclined to cover something torrid that happens while somebody's doing something in another role. I just don't know if that's true or not. Maybe the physicians can speak to that better, although I suspect none of them have ever been sued for their roles in medical directorships of VMS agencies or program agencies. So, this is probably an area that kind of doesn't exist much.
So, as appreciative as I am of your concern for my well-being, and the well-being of the other physicians, actually this is something that has caused some angst for some, and we have certainly explored some of these things at length. Most of the operational physicians that you have out there right now have very clearly indemnified processes in terms of patient care in the street. The biggest concern for most of us then becomes things that fall under things like director's insurance, and what happens then if in an administrative role to make a decision that ultimately ends up costing someone their livelihood. Some of that, to the people that I've spoken to in the past, would be covered through the indemnification of the voluntary role and Article 30. The rest actually, because Albany Med supports me in this role, Albany Med would be supportive of anything that occurred. The interesting thing across the board, obviously, is I think the greatest liability that this organization has is always taking someone's livelihood away. Because we will make decisions from time to time that someone should not be practicing pre-hospital medicine. And that is our purview, and that frankly is our mandate from the state in terms of credentialing pre-hospital providers. But it is indeed the biggest area of liability. So, thank you for the concern. I think continually reevaluating exactly what our insurance covers and what our duties and likely areas of liability are is incredibly important. We need to keep focused on that to make sure that in this litigious world we live in, that we've got coverage for the people that are committing a significant amount of time to making sure that pre-hospital medicine continues to advance in these services. So, good questions, thank you.
Have you ever gotten like guidance or information like from, and I may have the alpha characters incorrect, but NAEMT, is that what it is, or the physicians group that, you know, provides services similar to what you do regarding this? I mean, from what you just described, it sounds like the officers and directors is enough.
So the problem is, Jim, that there's a bunch of different roles that people work, even if you just look at the physicians that are local here. Many of the physicians work for private physician groups that then staff hospitals. Some of those private physician groups have decided that EMS medicine is an incredibly important part of emergency medicine, and therefore they write into their policy that pre-hospital medicine is a part of the coverage that they provide. Other organizations have not, or other physician groups have not stepped into that role and said that people can do that. Albany Med, where I'm actually employed by the medical college, through their faculty physicians, has said all the way along the line, long before I got here, that pre-hospital activities were something that they were going to cover because they thought it was an important part of their commitment to the region, the trauma system, and pre-hospital care in general. So that was something that they always have been very supportive of. They have a little bit more flexibility than most. They're a self-insured organization because of their sheer volume and size. So that gives them a little bit more flexibility to make those decisions.
And I guess my reason for the question was just, it sounds like Tim is more than likely going to have to provide some degree of steerage, shall we say, to the insurance company, and they're going to want to look somewhere. So that was my
The problem is there isn't one answer.
Yeah.
You know, much like we say.
What works in New York doesn't work in Indiana.
Well, it's not just New York. It's, you know, it's the old, if you've seen one EMS system, you've seen one EMS system. And this EMS system here has about as many different models as you can think of ways of delivering care in the street. We have a bunch of similar ways of getting emergency physicians into the hospitals, and then different models each one's going to face. There are medical directors' policies out there. In some cases, they will be redundant to what you do. I would say that the argument also needs to go back. We need to make sure to guide, and this is one of the things that I talk with most new medical directors about, is making sure that you're reducing your areas of liability of each of the individual organizations that you're working with. And that takes some time as well.
Tim, there's umbrella policies out there that maybe when you talk to your insurance carrier, that maybe an umbrella policy, which really is not that expensive, could overlap our existing insurance policy. I don't know, Rich, you have any other experience?
Yes, with umbrellas, exactly, with officers and directors and a general umbrella.
Right. So that's a possibility, and it's not real high cost.
It's relatively inexpensive to add it, because the umbrella only kicks in when you exhaust the limited coverage. Right.
Any other items from the floor? Motion to adjourn.
Also.